They said that they were feeling a little bit ill, not very ill, no coughing, no fever, and no breathing issues. And then 2 days later, when we hadn't heard anything from them, so we asked a neighbor who has a key to their house to check what was going on. And then the neighbor calls back and tells us that they have found my mother dead on the couch in the living room and my father almost unconscious lying on the floor in the bedroom. And my father was rushed to hospital with an ambulance, and then after 2 weeks he was discharged. And the doctors had said that he was no longer in danger by Covid-19. And then after 10 weeks, we found him dead in his bed one morning.
Emma was herself infected and is now struggling with long Covid. She's getting as much rest as she can in her house 90 kilometers north of Stockholm while grieving her parents.
Well, this is a memory wall we created. So this is my mother, together with my dogs, which she loved very much, as well as her grandchildren. And this is my father. He really loved gardening. Since they were taken away so suddenly and unexpectedly, I wanted them to be here in some way, not only for me, but for my children, who misses their grandma and grandpa very much. I believe that the Swedish strategy was to let this virus spread, not totally uncontrollably, but spread around society. And doing that, we lost many, many people, lives that could have been saved.
Many have accused Sweden of seeking herd immunity by taking a radically different approach to others. Neither a lockdown nor the use of face masks were considered effective in the war on COVID-19. Most Swedes back their government and follow recommendations, but calls to act responsibly and respect social distancing aren't enough. While Sweden's COVID death rate is roughly the European average, it's 10 times higher than that of neighbours Finland and Norway, Scandinavian nations with similar ways of life. In late 2020, infections increased rapidly and authorities reassessed their strategy, with a temporary pandemic law enabling some restrictions. Anders Tegnell is the man behind Sweden's strategy.
We have used less stringent legal measures and more voluntary measures, and that is very much because that is what the sort of legal requirements are in Sweden. We have had a great trust from the population in this and a great following on our measures. The measures have been very stringent, cutting down on the number of people they can have, how far they have been to sit apart, and also if they can serve alcohol or not. When we follow up with the regions that do the contact tracing, the message is that they very rarely see any spread that they can connect back to restaurants. So I think our belief and what we can say from the data we have is that the strategy to keep them open with these quite stringent measures, it has worked rather well.